Hello, and welcome to the Harley Street Health District podcast. I'm your host, Professor Jenny Shand. In this mini-series, we're speaking to leaders building health and innovation districts around the world, from Boston to Barcelona. At Harley Street Health District, we are increasingly intentional about the innovation and collaboration we're building, and we're keen to listen and learn from those across the world who are doing similar things to see what we're doing the same and where there are differences and what we can learn from one another. So today I'm here with Beth, who's in Boston. So Beth O'Neill Maloney is Executive Director at the Kendall Square Association. Beth, tell us more about yourself and your role.
Well, first of all, thank you for having me. I'm delighted to be here to tell you about Kendall Square and my role as the executive director of the Kendall Square Association. The association was founded 18 years ago by a group of visionaries who really saw the potential to really make this former industrial area that has a long history of innovation into something big, far bigger than it was then. And I think if you come visit us, you'll see that it is absolutely that. We have earned the title um, of the most innovative square mile on the planet. Not the most humble tagline, but nevertheless, I think it captures the spirit of the folks here who are challenged to do big things and to improve the world by improving human health and the health of the planet. As the executive director, my role is to bring folks together within the Kendall Square ecosystem so that we can continue to be an innovation hub where we tackle some of the world's biggest problems, and whether that is human health or the health of the planet. About 18 years ago, the Kendall Square Association came together, but Kendall Square's history is not quite as old as yours in London there. But at 400 years ago, the land that we were built on was really quite marshy. So over time, that land was filled, and it has been a series of innovation hub forever. Early innovations include the development of central aisles in rail cars, inflatable bike tires, the flexible rubber hoses, Stilson wrench, the land camera, it's zooming forward a little bit. There were innovations in manufacturing. The yellow highlighter, which so many of us use in academic
Wow.
context, was there. Yes, as well as and again, zooming forward a bit, it MIT particularly, was heavily involved in the advancing radar, which was instrumental in the success of the Allies in World War II. And development of the Android operating system, the Lotus 123 spreadsheet. Many of us use spreadsheets every day. And again, fast forward the Human Genome Project, which is done both here and in other places around the globe, including the UK. And finally, the development of the mRNA vaccines for the COVID-19. And the developments continue with cell and gene therapy and CRISPR and more. So it's really a place where so much is happening.
I mean, super cool story about that strong embedded innovation sitting throughout it. I mean, it's quite interesting. In Harley Street Health District, we've obviously evolved from very much a health provider anchor point, and that's how we've then sort of spread out into innovation, maintaining research and excellence in care. How do you define a health innovation district? What do you think are the essential components?
Well, it's interesting because in Kendall Square proper, we don't have a hospital, but we are sort of in the larger ecosystem. We have directly across the bridge in Boston, Mass General Brigham Hospital, which is one of known worldwide as one of the world's best hospitals. And we have a large cluster of hospitals just about a mile and a half away. And it's essential for the clinical trials to happen, to have these strong relationships with our neighboring hospitals. And Kendall Square is primarily research and development in the life sciences area. So the focus is on human health starting at the academic level at MIT, and then through our research institutes, where there are 3 or 4 of them, where the translational research from academic to clinical trials to bring this kind of biotechnology or life science solutions to patients, through clinical trials and then eventually through the production of therapeutics, biologics, and the like.
So there's a mix of organizations within the Kendall Square community, but then also you're describing that collaboration with those in those sort of surrounding areas as well. I mean, what do you really describe as the heartbeat of the district itself?
Probably a much debated point. I think that Kendall Square itself, the heartbeat is R&D and really the purpose-driven people and organizations that are really committed to improving the human condition. So are doing that through sort of deep tech technologies and applying AI to life science. Others are going deep on areas like immunology, neurology, the whole spectrum of rare diseases, cancer. Here in Kendall Square, there are 16 of the world's largest life science organizations, and the other four in the top 20 are active here as well. Um, and they are critical, but they are one piece of the puzzle together with the research institutes and the launch pads. So our larger life science companies are funders, are startup companies, those with a brave new idea and a research that they're pursuing, all happens here within this 1 square mile plus a little.
Yeah, which is like this fantastic concentration, isn't it, of that, as you describe, research, innovation, and then access to that delivery network so you can actually demonstrate and prove the impact on patients and outcomes. Tell us a bit more about how do you elevate that collaboration. There's a really lovely phrase that I've seen Kendall Square Association use around happy accidents and intentional partnerships. Just unpack a bit more about how you build that collaboration underneath that.
So I think that part of the reason we exist is so that folks can all talk to each other. So our board, the 30 folks I just mentioned, the representation from all around the community, including the cultural aspects that we have, and of course MIT and the institutes. So everyone is represented, and that's why the board is so large. It's a little unwieldy when I tell people we have a 30-person board, they say, "Wow." But the reason is we want representation from out the community so they understand that we all work together, that Kendall Square with no restaurants or no cultural institutions, no public art would really be a very dry and less interesting place. And one of the things we strive to do is we have host a number of events, but we want people to have cross-industry collaboration and
Yeah.
connections. So that's critically important. I do think that it's this sort of happy accidents, we refer to it as the bump factor. Every time I leave my office, I run into at least one person I know, have a chat on the street, and it helps us move things forward. And we really cultivate that in a number of ways through our events and through the promotion of our members' events. If you want to go to a lecture at the Broad to learn more about oncology, and the latest research in that area, we will promote that and you will run into other folks that are interested. Or you could come to one of our member socials where there's no scientific or other agenda. It's purely social, but you might find a postdoc from one of our institutes might chat with someone from Draper, which does completely different work. And another way we don't have quite as many shops. No, we don't have nearly as many shops as you do in the village, but we have a lot of third spaces where the MIT Museum is one. Most of the first floor of virtually every building is open to all and has either restaurants or public spaces where people can gather. You can sit down in comfortable chairs.
Yeah, I was just totally agree, Beth. And there's a bit of a balance we've been reflecting on, which is about that intentional partnership. So we sometimes talk about engineered serendipity. Like it's not just a chance coffee. Actually, you're in Kendall Square with all these different organizations, with all these like minds trying to do similar things. And so already automatically you're in kind of a community that you can belong to and get some benefit from. But we're also conscious about how do you keep it curated so that not wanting it to be unnecessarily exclusive and inaccessible, but recognizing that sometimes you do need to have some boundaries on how you manage those different events. I wanted us to just look a bit more about that innovation pathway. How do we catalyze these collaborations to build new ideas and solutions? So you don't want just loads of organizations pitching great ideas. You want to know that this is a problem that an organization has or a clinical pathway has or population outcomes have that we need to collectively solve. How do you help articulate the problems that your community might want solutions for and connect them with innovators that might be able to help?
I think that's happening more in our launch pads.
Okay.
So at Lab Central, for example, if you have an idea for a life science startup or you have a research area that you're pursuing and you think you're going to make an impact on a disease or eventually develop a therapeutic for maybe a rare disease or another condition, um, you can apply for space at Lab Central, and it's a very rigorous application process. So it's screened, but once you get there, and you are established there, you have shared resources, you have an incredible amount of support from the community. Pfizer is directly next door and surrounded, and Lab Central is surrounded by large pharma who are all interested in helping folks do everything from develop their pitches to understanding the steps that it takes to go from research idea to an actual therapeutic that will help patients. So that's where that work is happening. At CIC, if you have an area that's something that's probably a little less life science focused, it may be tech or deep tech, or we have another one called the Engine, and it's a similar arrangement to Lab Central in that you come in and you have the support, you have access to these million-dollar, multi-million-dollar pieces of equipment that you couldn't otherwise afford at a very reasonable rent with the support of both the staff at the Engine, as well as the community who comes in as sponsors to run programming and to work with you to help develop your idea. So we're connectors, and then I leave it to the experts to really analyze the science and make, viable
I
choices.
see. So you're not doing the scrutiny and vetting yourself. You're the connector and the communicator about what's happening across your partners. And then they have then got the skills and the processes and the infrastructure to support that. It's really interesting sometimes when you see some of these great ideas and we all celebrate big successes, and that's great for motivation, for impact, for brand building. So you talked a bit about, Kendall Square, your sort of square mile plus a bit, and that wider Boston connections. Can you say a bit more about how you link Kendall Square to Boston as a sort of geographic space?
Yes, so Kendall Square is so close to Boston. I can walk across the bridge and be in Boston in about 5 minutes from my office. And as I said, that Kendall Square and Mass General Brigham Hospital are right on either side of the bridge. Boston is a small but vibrant community that's known for a lot of different things. Some of the films I don't think they accurately represent us, but um, it's really a wonderful community, and I think that, again, I think the purpose-driven piece is critical, particularly with our hospital partners. The folks come from all around the area and around the globe on occasion to receive treatment here, and I think that the focus on human health is incredible. So our research institutes, for example, the Broad Institute is of MIT and Harvard, and that's in part because MIT doesn't have a medical school, Harvard does. So there are folks that work at Harvard Medical School that come across the bridge regularly to work and use their labs at the Broad to expand their research and to apply what they've learned in their clinical practice to their research practice and really and I think that connectivity so that we're not having folks work just abstractly, but we have clinicians that have the ability to pursue research that matters to their patients. And then I think, as we've grown, we like to use the phrase born in Kendall. 1 square mile is not very big. And so there are many ideas and folks that have started in Kendall Square and then gone and spread out in the larger ecosystem to build. We think that being part of a larger, stronger ecosystem is what's going to support us going forward and help us continue to be leaders in this field.
Yeah, and I love that phrase, "is sort of born in Kendall," because it's really about how do you bring those ideas together, get them validated, start proving their impact, and then help them to then sort of expand and spread how they can deliver that impact. And so we talked a little bit about the relationship with that wider Boston community. What about the international component? So you mentioned obviously you've got international patients that come, but how do you open the door to major global organizations to help with that sort of commercial scale?
Yeah, that's a great question. Well, we're fortunate that we are one of, several places on the globe that have large global companies operating here. So, for example, AstraZeneca is consolidating its resources in its R&D in Kendall Square. Novo Nordisk consolidated its US R&D in Kendall Square. Um, we have Johnson and Johnson has its innovation team or its corporate venture capital team is here. Bayer is here. They have a collab where they are fostering smaller startup companies. We do have our original biotech or life science firm was Biogen. And they just recommitted. They're building a brand new building, state-of-the-art facilities that they've already broken ground this summer. And they have chosen to stay here to do it because of sort of the impact of this, whether we call it the bump factor or the connectivity, and I think the purpose-driven connections that folks build in this community. It's where innovation
And
happens.
that's a great validation, isn't it, of the meaning and purpose of the district. And, we've seen in other health districts, people like AstraZeneca, who you've mentioned, making decisions to really concentrate their assets there. And I think that does show that organizations, both commercially and in practice, are seeing that being part and connected to some of these different parts of the translational pathway, commercialization pathway is really valuable and has a lot of currency to it. So one of the big trends at the moment is obviously AI, tech, digitalization of care. It's huge. And you've got MIT, obviously huge leaders in this space. How is the community evolving in this digital era?
That's a great question, and I guess, again, the global companies are connecting on this topic sort of around the world, but I think that we have a really interesting convergence of deep tech and life science in Kendall Square, with MIT, both in AI and in quantum, and both are evolving here. I think the focus heavily here, as opposed to further west in the United States, is on applied AI. How do we apply AI effectively to the life science, to drug development? And that's, a few years now, but that is something that what I'm really proud of is our community came together because obviously we have experts in AI and experts in life science, and they got together, but everyone in the community needs to know. So we held a couple of sessions. We call them Kendall conversations, so that everyone understands sort of what's coming, applications. Google has run sort of upskilling classes on this is how you can use AI, so that it's not just PhDs in the lab who are understanding the applicability of AI to industry. I'm very focused on the future, making sure that we are paying attention to trends that are going to change the way we, like AI, are going to continue to change the way we work. And I think quantum is one of those answers. And we're fortunate that we have. I think there's 80 plus people at MIT that are working on quantum in one way, shape, or form.
That's really interesting, Beth. Let's come back to Kendall Square and the community you've built. And you've mentioned community art, restaurateurs. With all that activity happening in the buildings, creating amazing innovation and solutions for the public benefit, how does that spill out onto the street and the surrounding areas? Tell us more about what it feels like to be walking around your square mile.
I think that one of the things I'm always amazed by, it's very clean. It's beautiful, the beautiful plantings and the public art. I'm moved by the public art. There's something to look at and see. So there's a certain vibrancy in the physical spaces. When you walk around, it's incredibly diverse. There are people from all over the world there. That makes it interesting. And we constantly have, there's the food trucks here. We embrace sort of the label nerd. We don't think it's a negative. If you, for example, the bike rack, we have a bike rack that is shaped like a molecule, and sort of it's a quiz. What molecule is it? It's caffeine.
Cool.
There's another bike rack
Is
that's
it outside a
like the
coffee shop?
sun.
That's, I guess.
Yes, exactly. So, there's sort of clever things happening. So we have in this MIT open space, which is another outdoor gathering spot with a large screen. They ship films in the summer. Yes, some people do walk around with their heads in their phones, but there's a quirkiness and a real effort for people to think and talk and connect.
I love that. And I love the role of art in trying to help people to think differently and pause and reflect on different pieces. And one of the other districts in Amsterdam was talking about their collaborations with community artists and a similar sort of vibe of how do you bring that sort of broader feeling and reflection space into these sometimes quite intense sort of health research environments. It's not only being passionate about what you do, but it's also what you do before and after work. And how does that build joy in your job, but also joy in your life? So great to hear about all the different things that you've got. When we talk about Harley Street Health District, we've got lots of facts and figures that I'm always fascinated and ever learning. So, for example, we have more phase 1 clinical trials happening in buildings in the district than in UCLH, a huge tertiary academic hospital next door. What's your favourite fact about Kendall Square?
Oh, there are many, but one of my favorites is so years ago we were tagged with the line "the most innovative square mile on the planet," which I love. It's not humble, but I do love it. And one of the origins of this phrase was the fact that there are at least 105 Nobel Prize laureates that come from this area. And that's just incredible. So that's one of my favorite facts and figures. We give a founders award to people who represent what the vision that our founders had. And one of the people we recognized last year was Sangeeta Bhatia, who's a serial biotech entrepreneur, MIT professor, and she's one of the co-founders of the Faculty Founders Initiative to broaden the aperture of folks that found companies. She's worked very hard to ensure that the mentorship is there and that the opportunities are there.
Yeah, I couldn't agree more. And I think that role of mentorship is often so sort of silent, but such a soft and important power that sits behind everything. And when we talk about impact and how do you describe impact, and there's great facts and figures that look amazing, but actually it's really hard often to characterize the impact that supporting someone through their innovation journey can have, that mentorship that can come from the community, that access in a structured way, like you described in the labs and other sort of accelerators of helping people to build those skills. So it's really exciting to hear that you value that as much as we do. Really pleased to hear that.
I would love to add, so one of my favorite facts and figures, and it's different from the science, is that every year we run this Kendall Square Challenge. In fact, it's part of the reason I took this job is because I realized that while this community is quite serious about their work, they know how to have fun and they're also caring. So the Kendall Square Challenge is an event, and the fact and figure I love is that we have 55 teams. Over 550 people participate in this challenge, and we support local nonprofits. And last year, I think we were able to donate $60,000 across this small group of nonprofits, which made an impact for them. And what the challenge is it's basically a community building, fun, philanthropic event that highlights both competition and collaboration. So folks have 2 hours to work their way across Kendall Square through different places and spaces and compete and collaborate in these various challenges, some of which are very cerebral, hard math questions, or maybe a Kendall Square history question, some of which are physical relay races, and some of which are just plain silly, like make a paper airplane and make it land on the target of the moon in reference to our member Draper. Um, and at the end, it is all to benefit nonprofits. So that each team pays a team fee. We cover the cost of running the event, and then we make that donation. So there's a philanthropic aspect, but also fun. And we end with a large block party, we call it, with a band and food from our local restaurants, and everyone gets together and really has fun. So we really want to connect people across and between and give them the opportunities to give back in ways that are different from what they do perhaps at a lab bench or elsewhere.
I love that. And I love that people can participate that by being part of your community across Kendall Square rather than it always being organization by organization. So feels like a really fun time to be in Kendall Square when you've got your challenge on. When's your next one?
It is June 11th, 2026.
Okay. All right. That would be good to remember. Beth, thanks so much. We've learned so much about Kendall Square, and I'm really excited, particularly about the challenge and some of the other things you've got going on that help build that vibrant community and make it a fun place to visit as well as work, by the sounds of it. We're talking to several different health innovation districts, and we know that people listening to this podcast are interested in learning from them all. What do you think makes an innovation district thrive, and what advice would you give to others?
I think innovation districts thrive when they build on their strengths, acknowledge their weaknesses. Maybe they shore them up. Maybe they decide to accept them and really build on their strengths. But I think it takes champions and a shared vision and a shared ethos, a real belief that they can make an impact in whatever areas that they're working on. So my advice to folks doing what we do is to really find those champions in your community and stay focused on that vision. And then the final thing is, and I think Kendall Square is a terrific example of this, is to constantly be agile and willing to evolve. we have seen Kendall Square ebb and flow over the years, and our intention is to ensure that it continues to flow and to lead not only in life science, but in climate science and deep tech and tough tech. And we think that working together and with our champions, we can do that. And I'd encourage others to do the same so that we can all tackle some of the world's biggest challenges, including human health.
Thank you so much, Beth. I mean, the power of community is definitely shining through. And I think all of us are evolving. I think our journeys to where we've got to so far as districts and where we're taking them next are moving all the time. So it's great to hear those reflections. Thank you so much for spending some time with us. And thank you to everyone for listening. Really appreciate it.
Thank you.